My name is Tim Berg. I'm a general surgeon here in Kerrville. I went to medical school at Wake Forest University, where I also did my surgical training. And how I wanted to be a doctor, I guess, started off when I was a little kid. I loved cutting things open to see what was inside of them. I remember dissecting fish and frogs and stuff like that, and figuring out how things work. So I think that was kind of the beginning of my surgical career. What attracted me to general surgery, and the reason I decided to become a general surgeon, was I think in large part by the people that I worked with. Where I did my training, these were guys that really cared about their patients. They were really good doctors, and we took care of a lot of difficult problems, and I was very inspired by those people. And that was probably the influence that brought me to the specialty of general surgery. One of the things that attracted me to general surgery in particular was the variety of conditions that I treat. It used to be said that general surgery consisted of the skin and its contents, which maybe is a bit of an overstatement, but nevertheless, we treat everything from trauma to malignancies to infections, and I think that was what attracted me, the great variety of different things that you can treat and requires you to think and not just be a technician. I grew up in Huntsville, Alabama, and then did my medical school and residency in North Carolina, after which I met and married my wife, who was a Texan. Now, we started having babies and started visiting her family here in Texas about every 3 months, at which point she started pining for home, so to speak. And so I told her, I said, you show me a pretty place in Texas and I'll think about moving there. And of course, here we are in Kerrville, and that was 1996. I've been with PMA just a couple of years, but was in practice, private practice here before that, really since 1996. When I left, I went overseas and did some mission work in East Africa. And when I returned home, we had to return home for personal reasons, and then I needed some work to do. And as it turned out, they needed a surgeon at PMA, so I was able to join back in, albeit in a different role. So PMA, I think, was born out of the need for primary care, specialty support here. And then I think it's become more of a unifying factor with the medical staff, something that going from individual private practices to more of a single entity, I think has been the thing that is unique for a small town. One of the best things about working and living in the Hill Country is the just sheer convenience and the lovely atmosphere of life here. For example, it just takes me a few minutes to get to work. I can ride my bike to work. I don't fight traffic jams. There's no stress. I see my patients that I know and care about just in everyday life here. And overall, it's just the quality of life in general that makes living and working in the Hill Country so wonderful. When I'm not at work, I have another job, mainly my family. I have 4 biological children and an adopted son who's still in school, and the others in college or just graduated. So a lot of my work or time is spent dealing with the kids. But other than that, I enjoy working out, riding my bike, jogging, swimming, and playing with my dog and that sort of thing. So I love Peterson Health because of the people I work with. The caring that I see exhibited for my patients is maybe unmatched, at least in my experience, in healthcare. That's what makes Peterson Health special.